The first word that comes to my mind when I think about mental health research is inequity.
Over 900 million people are living with a mental health condition today. Over 700,000 people die by suicide globally every year, but those are only estimates because we have so little data on what's going on in low and middle income countries. We know that depression's on track to be the biggest burden of disease globally by 2030. The impact it will have on the individual can be lifelong. In fact, the number of disability life years lost is greater in mental health than any other condition on the planet. This sort of growing wave of mental ill health is something that we have to tackle. MQ Mental Health Research was set up a little over a decade ago by the Wellcome Trust. It was a first initial investment into mental health research that was novel and was exciting at the time. It was really trying to spearhead a way forward in which mental health research could have impact for patients in a way that it maybe hadn't had in the 10, 20 years before that. MQ builds itself on two kind of major philosophies. The first one is that all the research we conduct has to be driven and led by patients. So that means understanding what symptoms they want to see tackled and what really good interventions actually look like. And the second one is we want to fund best-in-class research. We want to look all over the globe and find the brightest and best scientists to advance that research on behalf of those patients. And by being an independent charity, that means we're able to put those two philosophies together and invest into what is seen as fairly risky investments that other funders might not engage with. So looking at treatments that could really make a radical difference or change, or ones that are sidelined or marginalized by other philosophies of thinking. We have new treatments for PTSD that are now going into broader trials. We have projects that are delivering mental health services in Uganda to people with HIV that are now being expanded across into multiple countries. We've proven the link between fortification of food and brain health in the uterus. And so for all of the research that's been invested into, we are now 10 years on starting to see real genuine impact in both the way in which policymakers make decisions using that evidence and how treatments are then put into action.
The Mental Health for All lab at Harvard Medical School is intended primarily to generate knowledge and also to promote its uptake towards the cause of reducing the burden of suffering due to mental health problems. Depression is one of the most common mental health problems in the population. And we know that there are at least two major classes of effective treatments for depression that can be delivered in primary care. You have antidepressant medications on the one side, and you have brief psychological treatments, particularly behavioral activation, on the other. Optimize-D, being conducted in urban primary healthcare centers in the state of Madhya Pradesh in central India, is the first major evaluation that is seeking to compare these two widely used treatments, but asking the question, who is likely to respond better to one or the other treatment, so that in the long term, that information can be used by primary care physicians and other people working in primary care towards allocating individuals to the kind of treatment that they are more likely to respond to. This is, of course, the holy grail of precision medicine.
My area of research really focuses on improving access to evidence-based mental health care. The major difference between men and women with regards to their mental health is that women are treated differently. And this is very much a reflection of society at large. For example, women are diagnosed with conditions such as bipolar disorder on average 4 years later than men, which basically means that they are left untreated. And when they are left untreated, their conditions become worse. The SUMMIT trial, which stands for Scaling Up Maternal Mental Health Care by Increasing Access to Treatment, is a large multi-site trial that's being conducted in Toronto, Chapel Hill, and Chicago. The main goal of SUMMIT is really to improve access to effective mental health care interventions for pregnant and postpartum women. And the way that we're doing this is to compare non-specialist providers to specialist providers, and to compare telemedicine-delivered psychotherapy to in-person psychotherapy. If telemedicine-delivered psychotherapy by non-specialist providers is as effective as the gold standard, which is typically in-person specialist-delivered care, this will be a huge game changer.
Both the Summit trial and Optimise D are great examples of the types of research MQ wants to see more of worldwide. What they do is take a whole person approach and understand how treatment or intervention can be tailored for those individuals. The evidence and data that they generate is openly available to everyone, and they are looking at mental health from a global perspective rather than zooming in on one homogenous population. And so their ability to have impact is absolutely phenomenal.
Mental health is shaped by a convergence of multiple factors. Our genetic inheritance, the early life experiences that we have from birth all the way through to young adulthood, what's going on in our lives at this particular point, and of course, our biology. And it's this kind of convergence of all of these different factors that makes the experience of mental health of each individual so unique, so personal, so intimate. If there was one really important area that I believe requires a lot more investment in mental health research, is to understand how we can minimize the exposure to adversities in early childhood all the way through into young adulthood that we know are profoundly important in shaping the mental health of an individual across their life course.
More people today know about mental health than ever before. And this means that people will be advocating for their mental health and the necessary research to support that mental health. Organizations like MQ are a perfect example of this investment. For women in particular, we know that people are seeing the connection between women's mental health and their children. They're seeing the connection between investing in women's mental health and society. And this is really, really important because they're recognizing that it's actually beneficial to invest in mental health care.
The reality is, if we're going to tackle the growing challenge of mental health, we need to stop looking at mental health in a silo of its own. We need investment to come from education, from physical health conditions, from government policy, from philanthropists, all coming together to create a focus on how we change the course of mental health. And so what we really focus on, led by our International Science Council, is scouring the globe for the best ideas, for the best research and best science that hasn't yet made it into the marketplace, and translating and supporting that translation process so that patients can receive treatment and interventions faster than ever before.